To hear Senator Conrad from North Dakota try to present different ideas about a way to navigate through a tough issue in healthcare reform and really stretch to find a compromise position, and hear Republicans say no, 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 no. It makes me think of a little kid who's throwing a temper tantrum. No, 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 no. That's not going to get what the American public needs. So the public is being scared in very deliberate ways.
There has recently been strong objections to a public portion of the health care reform. But when we speak of public, Medicaid and Medicare are included. And it appears to me that many people don't know that that's really what they're talking about when you say public. We have lots of activity in the public portion of this now. And I've wondered whether or not people that are against the public part of it, if they just want to do away with Medicaid or Medicare. Have you had any conversation?
Well, there's a very strong debate now about whether we should provide every person in the country the option to purchase a public or government, not government run, but a plan that has government, some government control that is different from what we get from private insurance companies right now. And there's a lot of ideas. Some of them look more like Medicare, some look less. The public out there says, I want more choices. I want to take a look at this and see if that works better for me. There again is a lot of talk about how that will lead to a totally government-run system, and that's just not true.
Oh.
We're talking about giving people the choice to have something that would look something like Medicare as an alternative to what they have now, or purchase coverage through private plans. And the issues that make people nervous about this is if we have a level playing field of competition, the government might actually do better. Okay, I don't have a problem with that. Let's let the race begin. Let's see who does best. Who serves the people. Insurance industry is very nervous that their model, which does involve some pretty profitable ways of operating, could be challenged by this. I don't find it scary. I find it refreshing to think I'd have different choices. Again, there's a lot of hybrids of this idea, so we make sure that doctors and hospitals are paid fairly by any program like this, a public plan. So that has made many of the physician community embrace it.
Well, I know that small businesses make up the strong portion of our economy in this country, but most of them are not large enough to offer health coverage. How are we dealing with that?
Well, first of all, I should say I work for a small business, and my husband owns one. And small businesses are struggling to be able to offer insurance to their employees, and I've never met a small business owner who didn't want to do the right thing. And they often feel like their workers are family, but they can't afford the premiums. So the plans that we are looking at, that you are really looking at in Washington, would provide additional help to small businesses, some additional dollars to help them afford their side of the cost of coverage. And we're looking at letting them have this fuller range of choices that we talked about before for all Americans. I think small business will be a win-win in healthcare reform. And there's a report that came out last week by a group called Small Business Majority, run by actual small business owners. They're not affiliated with any party. And they said small business will have tremendous savings if healthcare reform happens. We feel some pushback from other elements in the business community.
Well, in some communities where there are members in chambers of commerce, for example, which becomes then a kind of a blanket that they go into one group and then they can negotiate like a very large business. I've heard some small business complain about it's not all inclusive, that it is either by zip codes or different requirements. Have you heard much about that?
Well, the way the insurance market operates right now for small business is full of inequities, besides being just very expensive. Some small businesses have to pay much more than others because their workforce is older or sicker, or if you're in certain zip codes, you may have to pay more. It's not a very well regulated market. So we want small business to be able to come into a new market where the behavior of insurance companies is better regulated so that they treat small businesses fairly. The Chamber of Commerce has actually been, in fact, pretty supportive of healthcare reform, at least up to this point, as has been other business groups like the National Federation of Independent Businesses. And I think they feel pressure from the chambers at the state level and in the cities in Dallas to say we need help. So what are you doing up there at the national level opposing healthcare reform? Yeah. We're here in Dallas or St. Louis or Janesville, Wisconsin, and we need help, and this could provide help. So why would you want to oppose it, National Association? So a real rebellion, perhaps is the right word, at the state and city level among those associations.
Sure. A lot of the rumor mill has frightened a number of people about what might be coming in healthcare reform. And I'm really concerned that that fear part of it will manipulate how the reform comes. And I'm hoping that we'll have more and more education so that people really do understand where we're trying to get with this coverage. The other factor that will make a great deal of difference too is to computerize records so that it won't be so much duplication of lab tests and know exactly who the person is that comes into an emergency room, what have you. And that will save a great deal of money. But I guess the major goal is to make sure that people have a way to get primary care, preventive care, so they won't end up in the emergency room because they have no health care coverage.
That's right. I mean, you've hit on some great themes there. We're going to save money by making it more efficient. Electronic records are part of that. And we're going to make sure that everyone can get coverage that's affordable, that's quality, and they have a choice of where they go to get that coverage. I don't know what there is in this scheme to scare people. So we just have to keep educating people.
Well, thank you. We're out of time, but thank you so much for coming, and I appreciate all the work that your organization does to inform families and to keep them number one for attention in this country. See you next week.
This has been another edition of Report from Washington featuring Congresswoman Eddie Bernice Johnson. You can reach Congresswoman Johnson at 202-225-8885 or 214-922-8885. You can also contact her through her website at http://www.house.gov/ebjohnson.